Hi all, welcome to the Psychoculturalist. Today's video is on health beliefs. But first, I realized I spoke about crazy cultural practices in the last video, but forgot to define culture. It'll be helpful for this video as well. So culture may be defined as behaviors, values, and beliefs shared by a group of people such as an ethnic, racial, geographical, religious, gender, class, or age group. People can ascribe to multiple cultural groups, thus making an individual a blend of many influences. Culture includes influences of dress, language, religion, customs, food, laws, codes, mannerisms, behavioral standards or patterns, and beliefs. It plays an important role in how people of different backgrounds express themselves, seek help, cope with stress, and develop social supports. Culture affects many aspects of an individual's life, including how we experience, understand, express, and address emotional and mental distress. So, all cultures have systems of health beliefs to explain what causes an illness, how it can be cured or treated, and who should be involved in the process. The extent to which patients perceive what a therapist will tell them as relevant has to do with their culture and how well it fits into the system that they have. So, Western societies, such as the United States, see disease as a result of scientific phenomena and advocate medical treatments that combat microorganisms. But other societies believe that illness is a result of supernatural phenomena and promote prayer or spiritual interventions. So, as you can see here, how certain recommendations for treatment may lead to non-compliance from a patient who may have different health beliefs. It is also important not to assume non-compliance, as there is immense diversity within a culture and within an individual. Among many Asian patients, because the behavior of an individual reflects on the family, mental illness or any behavior that indicates lack of self-control may produce shame or guilt. As a result, patients may be reluctant to discuss symptoms of mental health or depression. In Vietnamese culture, mystical beliefs that explain physical and mental illness are present. Health is viewed as a result of an harmonious balance between the poles of hot and cold that govern bodily functions. Sometimes they do not readily accept Western mental health counseling interventions, particularly when self-disclosure is expected. However, it is possible to accept assistance when trust has been gained. Cupping is an alternative form of medicine used in some Asian cultures, where special cups are placed on the skin for a few minutes to create suction. Cupping therapy supporters believe that this wet cupping removes harmful substances and toxins from the body, which promotes healing. Some Latino and African American cultures believe that older family members and other relatives should be respected and are usually consulted on important matters involving health and illness. They may refer to home remedies or consult a folk healer. Church is also an important support system for both African Americans and Hispanic patients. Native Americans believe that a state of health exists when a person lives in total harmony with nature. Illness is viewed not as an alteration in a person's physiological state, but as an imbalance between the ill person and natural or supernatural forces. Native Americans may use a medicine man or woman known as a shaman. As can be seen here, each ethnic group brings its own perspectives and values to the healthcare system, and many healthcare beliefs and practices differ from those of traditional American healthcare culture. Unfortunately, the expectation of many healthcare professionals has been that patients will conform to mainstream values. Such expectations have frequently created barriers to care and have been compounded by differences in language and education between patients and providers from different cultures and backgrounds. Addressing these barriers is important because it can play a huge role in diagnosis and treatment. It can also help strengthen the therapeutic alliance and can explain the low rate of minorities seeking mental health treatment. So how can one employ culturally competent strategies? Here are some. Use open-ended questions to identify each person's unique cultural outlook. Reevaluate intake and assessment documentations as well as policies, procedures to be more inclusive. Employ qualified mental health workers who are fluent in the languages of the groups being served. Understand the cultural biases of the staff providing training and address educational needs. Understand the cultural biases in program design. Identify resources such as natural supports within the community to help an individual recover. Design and implement culturally sensitive treatment plans. Evaluate procedures and programs for cultural sensitivity and effectiveness. Survey clients and workers to elicit their understanding of cultural competence and culturally competent practice. So, hopefully, those are some useful strategies that healthcare professionals can take with them and use in their daily practice. But generally, I hope this video helped you to become more culturally sensitive to different healthcare beliefs. If you have any questions, comments, or ideas that you'd like us to talk about, please remember to comment below and to check out our other videos. Once again, we're the Psychoculturalist. See you later.